Totally.
So thank you for that. And so the next few topics that I'm going to get into, I mean, I've talked about them on the Art of Mindful Medicine before. You've talked about them on Ask the Dentist numerous times. We could do podcasts about each one of these topics.
Totally.
But I do want to just touch on them to just give basically an update where we are now, because things are changing quite rapidly, and just
Right.
and if it's the same, great, it's the same. But just so people can have a really solid update on these really important topics, and there's some of the most common things that people come in asking me about as well. So number one, probably most controversial, or one of the most controversial, is fluoride.
Yep.
And you recently did a podcast with Dr. Perlmutter, who I think is brilliant, and I really enjoyed that. And
Agree.
he talked about the fluoride and how it negatively impacts the mitochondria, the thyroid. You've talked about the brain and IQ issues and things like that. But so
Right.
Where are we at with fluoride at this point?
Great question. You're right. We could talk easily for 2 hours on that. I'm just trying to make the message very clear and concise with actionable items. So you definitely want to stay away from fluoride. We've been sold a bill of goods. I'm not going to get into who it is and why and what the motivation is. I think most people would understand that it's financially motivated. And I think the profession should take some of the blame. We kind of have promoted the message, even though there's no evidence really that supports that claim. There's more evidence that support now. There's more evidence now that supports the claim that fluoride is bad for us than there is that it's good for us. And then there are these two different kind of ideologies, like, well, fluoride topically at least will help remineralize teeth. That's true, but so do other minerals, like hydroxyapatite. But there's and so that camp is like, yeah, but it works. And Prevident 5000, it does work. I used to recommend it to my patients, and it does work. It's a toothpaste that has prescription levels of fluoride in it. And if you swallow it, it upsets the stomach and it's toxic, but they don't really talk about the real toxicity, and that is the brain. But that's besides the point. So we're guilty of this in dentistry. We're like with silver SDF, the nano form of silver with fluoride, sodium fluoride, and that does slow down fluoride in a child's mouth. But where does that silver nanoparticle go? It's not digested, it's not expelled through urine, or it gets walled off, and it can stain tissue as well. So, but it's not as toxic as fluoride. I don't want to confuse people. So, but we're always like, we're so focused as dentists, like, just stop the decay, brain damage. I mean, it's like, well, I would much rather fix a tooth than fix a brain, right? That's what we're guilty of. We're wearing these, what do horses wear? The halters,
the blinders.
The blinders, right?
Yeah.
I mean, we're wearing blinders, and physicians do that, cardiologists do that, neurologists do that. We're all guilty of that. And that's why you have to cast that net wide. And if you don't know everything, then bring in other people and other practitioners. So the short message, again, rabbit hole on that, can go deep on that and to the point of frustration and anger and any of that. But so profession is kind of in on it. Sorry about that, everyone. We were sold a bill of goods as well. But the data now, there's enough data where protect your children if you're pregnant, or if you're thinking of conceiving, because you may not know, that you're pregnant until you get the test. Make sure you're filtering fluoride out of your water. Do not expose yourself to ingestion of fluoride, even fluoridated toothpaste, I would say, or the varnish when you go see the dentist. Fluoride does get absorbed through the oral mucosa. We have studies on that. There are some studies, even recent studies, that say that there is no absorption of fluoride. We have plenty of rat studies that show that, where they measure fluorides given to the lining of the esophagus of a rat, or even the oral mucosa. It's all very well done. And within 10 to 12 minutes, they can see the fluoride at very high concentrations in the blood. And we know that once it's in the blood, we have other studies that show that it does cross the blood-brain barrier, especially as you get older, but it does. And hopefully you heard the Perlmutter interview, and I was so excited to speak with him because I know that fluoride gets to the brain. I'm convinced of it. I've seen the studies. And then I've read about the damage it does to different parts of the brain, but I couldn't really go beyond that. And he explained it very well. I mean, it affects the mitochondria. That's the powerhouse of the brain. It affects the pathways of communication in the brain, the outside layer of neurons, the lipid layers of cells, and it basically dumbs you down.
Yeah.
I mean, it reduces your IQ at an early age. And so the message here, and I think this is the message that dentistry needs to start speaking up about, is that fluoride is dangerous. And then, yes, it does help topically mostly remineralize your teeth, but there are varnishes coming out with hydroxyapatite in it. And so we're going to, once those are out, we're going to make that information available where you can buy it if the patient has to buy it, and bring it into their dentist, because they're tired of being shamed by the dentist. Like, oh, you don't want fluoride? I mean, I know some patients that have been fired by their dentist for not wanting the fluoride varnish for their kids. And
I had to leave a practice just for that reason.
Exactly. It's very, very sad. But anyway, keep fluoride out of your life. I think you're better off for it. My kids were raised without fluoride. Back then, I didn't have any of the studies, knowledge of the studies. They didn't exist, but I just had a bad feeling about it. So we filtered our water. We filtered it free of fluoride. We distilled it. That was the only way I knew back then how to do it. We had to add back the minerals, but they were all raised without fluoride. When they went over to their friend's house, we gave them water bottles. We made them a little anxious, I think, because we told them, don't drink their water. I don't care if it comes out of a bottle. Don't drink it. And they were like, okay, sure. I'm sure they had some, but they weren't drinking fluoridated water. So I would stay away. One last point. There is a lawsuit against the EPA. The DOJ has been defending that lawsuit, not very well, I would say. I'm hoping, it's been going on for about 3 years now. There was a delay because there was a report that the NTP, the National Toxicology Program, it's kind of the research arm of the CDC, on looking at studies and agreeing with them or not, helping government officials legislate on products like PUFAs and Teflon and other forever chemicals. And all the news is good in the favor of trying to get fluoride out of our water. But we've got 4 more days coming up in November, and we'll see. But I'm hoping that we finally get this out of our system, and it is in the courts right now. And it doesn't get a lot of press. I don't know why. I talk about it all the time. It gets suppressed. I'm not sure why, but I think we will have, and already, back in the late 90s, the level of fluoride went from 1.4, 1.5 parts per million down to 0.7. So it's already been lowered.
Yeah.
We need to get it out of our system completely. We have plenty of ways of dealing with decay and issues like that. And we cannot fix the brains once they've been damaged. It just doesn't work. So let's think in a functional kind of approach here. Whole body.
Absolutely. And to sum that topic up, it's kind of like what you always say. You know something's toxic, and if you didn't have an alternative, maybe you can make an argument for it. Right. But now we have an alternative that's really natural and biocompatible. Right. So in hydroxyapatite, so there's no excuse really not to use that.
Exactly. And if we really address the root cause of decay, we wouldn't have to deal with it if we talk about food. But the food industry doesn't want us to have that conversation. No.
Correct. And I think you just touched on a little bit as to why it's not being spoken about.
Right. Yeah. I mean, they demonized saturated fat, animal fat, remember? Because they wanted us to eat carbs. The markup and the profit margin on carbs is huge. Mm-hmm. And it's, box of cereal, big profits. Yeah. I always recommend everyone read this one. You read one health book on, well, actually there are 2. There's Food Fix by Mark Hyman, but also the Big Fat Surprise by Nina Teichholz, an amazing book. Fantastic.
Yeah, that's great. The Big Fat Surprise.
Yep, by Nina Teichholz, an amazing piece of healthcare journalism. She has a website. I just found out about it actually. But read that book. It's a great book in the sense, and so is Food Fix.
That I have.
Yeah, that's his best book. It really exposes the food industry. They are profiting from your healthcare issues, and they know about it, and they've actually their business plan is modeled around it. And now, of course, they've come up with the what's it called, the fat drug, the weight loss Opesmic. What's it called?
I don't know.
Yeah, Ozempic. Yeah.
Ozempic. Oh, I
Yeah,
have heard of
Ozempic.
that.
Yeah, yeah. So it's the perfect business model. It's like, yeah, get them hooked, get them fat, get them sick, and then put them on a drug that if they're off the drug, they're going to get fatter. I mean, it's like perfect. You know, all the Hollywood stars are on it. I mean, it's just, oh my God. Oh my
It's
goodness.
yeah, like you said, we could talk for hours about this.
Yes. Very
So
frustrating.
the next big one, and that is amalgam or silver fillings. And
Right.
I don't think there's been any. Well, no, there have been updates on this in the past couple of years via the FDA. But
Right.
I'll let you talk a little bit more about the issues with amalgams and the updates.
Yeah, it's kind of old news to me, and I'm hoping that the message has gotten through. It's not as dire as fluoride because there's still a lot of misinformation there. I think most practitioners, I know a lot of physicians that don't recommend. I mean, they literally, if there's a neurological disorder, they'll say, "How many metal fillings do you have?" I mean, I think we're already there, not 100%, but again, mercury is released in a metal filling. We used to think it was inert once it was hardened. And if you have metal fillings in your mouth, and if you have neurological disorders, you should think about having them removed. Not every dentist can remove them properly. There's a methodology or a protocol called the SMART method. And I would definitely seek out someone that uses that method to do it properly. Unfortunately, it's expensive. But unfortunately, I think the bad news is that I would say 50% of dentists are still using amalgams on a daily basis, maybe
That's
more.
what I was going to say.
Yeah.
The practice that I had to leave, like they still use amalgam, and I tried desperately to explain and show.
Right.
I even showed the new the new FDA. This was obviously a
Right.
few years ago. The new
Exactly.
FDA guidelines. It's like,
Yep.
do you think it's just affecting these people?
Right. No. Yeah. And so those FDA guidelines that you're referring to are if you're pregnant, have an immune disorder, or
Child,
children.
comorbidities, kidney disorders, things like
Yes.
that. If you're
Yep.
planning on becoming pregnant.
Right.
So
Yeah.
really
I mean,
important things to look at. And this is on the FDA website. You can just
right.
go look
Exactly.
it up right on their website.
Exactly.
There's multiple pages. I mean, you have to search a little bit because
Right.
it wasn't exactly
Yeah.
blown up in the news or
Right.
anything. But
Yeah. I think women that are pregnant are being more and more about fish and mercury content in fish than they are in their fillings. And there's lots of data that shows that it's debatable on where that dose is coming from and how it, how significant it is. But yeah, it's change is slow when it comes to healthcare and government. And that's the great role or purpose for oral influencers. I'm trying to give information to my followers that is fresh and based on recent studies, and I only give them information based on that. And if I'm have an opinion based on that data and it hasn't been scientifically verified, I will say that. But at least it's 10, 15 years, maybe even 20 years ahead of what healthcare practitioners are doing and then what government is legislating or trying to legislate.
yeah. So our next topic, I think, to me, it's between this and fluoride, which are the most controversial topics, and that's root canals.
Yes.
Right.
Right.
So I'll let you give your views and thoughts and experiences with root canals.
Right. So from a biological standpoint, a root canal doesn't make sense. You've got tissue that you've removed inside of a tooth. The body still sees the tooth as it does. It's connected via ligaments, periodontal ligament to the alveolar bone, the bone that encases the teeth. The teeth are wiggling in the sockets a little bit because of that ligament, but you're taking out the tissue, the neuronal tissue, and lymph channels. There are lymph channels inside of dentin, and you're maybe leaving bacteria behind as you do that. You're trying to disinfect. Actually, you're trying to sterilize the inside of a tooth, which is impossible. Well, let's use the word disinfect. And you're hoping that none of those bacteria will leak back out. And there's controversy on how that happens. Typically, it's out through the apex, which is where all the blood vessels enter. There's some people that are saying that it can leak out through dentinal tubules. Okay, possible. And And then if you look at how difficult it is and how technique sensitive it is to literally fill and seal off all those canals, it's not just one little canal down to the tip, especially the first upper molars. I mean, with the CBT scanning now and all the imagery we have, I mean, it's amazing, all the channels and anyway. The question is do we have the technique to properly debride and cleanse and disinfect that tooth to the point where the immune system doesn't recognize a infected area of the body? I'm saying all this because it's too simple to say, you've got dead tissue in your body. A lot of people do well with dead tissue in their body. We have examples of that. There's dead heart tissue, there are implications, but it depends on your immune system. I mean, your immune system, for example, every time you go see the dentist, and you get your teeth clean, there's a bacteremia. There's an infection going into your bloodstream for 20 minutes. It's a transient bacteremia. Your body does very well with it. So root canals have a bad name for several reasons. The number one reason is because they're done poorly. They're done poorly. They're not sealed off properly. And because of that, in time, could be months, it could be decades, the bacteria will have a systemic immune response, and it could take you down, literally. It doesn't happen often, but this whole thing of if you have a root canal on the left side, you're going to get breast cancer on the left breast. There's no clinical evidence for that, and that's not how the body works. If it did, it would be breast cancer, not bilaterally but unilaterally, right? So the alternative is take the tooth out. Then you're dealing with an implant. Implants aren't perfect. You lack that biological width, and bacteria can get in there because it's not sealed. That girdle of tissue around the tooth, around the DEJ. Most people will have a little exudate around implants. There's a little bit of immune response there. Then the other alternative is no tooth at all. Well, that's not good because that affects your digestion, your ability to chew food. It shortens your lifespan. We've got correlational data there. Mm-hmm. Lots of it, actually. So the best thing to do is not get a root canal. And I realize that that's not a very nice thing to say, because if you fall unexpectedly or you're in a car accident, the tooth will crack. Then the pulp will die. It'll become infected. And then you clean that out, fill it, seal it, and then you can keep that tooth. So I'm not really answering the question. I think root canals are fine as long as they're done really, really well. There are only a few practitioners right now that are doing that in the US, with lasers and ozone and then you have to watch it. You have to take a cone beam and make sure it's not a fractured tooth. Most root canal failures within the first 6 to 12 months are a fractured tooth that you couldn't see. And it's the fracture that takes you down and leaks. It's not necessarily the quality of the root canal that was done. And usually that's when teeth start hurting. As you fall off your horse, you jump, you fall off a trampoline. When you fall, you may not have a blow to the face, but your teeth are in such a way that when you hit the ground, 2 teeth hit and one or both will fracture. And these are hairline fractures that are very difficult to see, and that's what takes down the tooth. You can get the patient out of pain by removing the pulp, but over time, that tooth will fail and will become infected. An infected tooth is a pretty dangerous thing. It does get into the bloodstream. It gets into the bloodstream. It sends toxins, direct infection. There's injury by infection. It increases inflammation, and then there's infection by those bugs releasing toxins, and that can take you down. I mean, to the point where you die from a tooth infection, and that would happen often before modern dentistry. So there are lots of movies out there. The big one was Root Cause, Netflix, that was taken down. I would say that if the root canal is done properly and monitored, maybe it's not for life that you can keep the tooth, but you can keep it safely, then that's fine. But you need to know, what are your CRP levels? What are you sick? Are there other issues going on? And sometimes it can be a tooth. And taking the tooth out will not heal you right away, but it could be contributing to some systemic disease entity or symptomology. And so I would say the majority of root canals are not being done properly in the US.
I would definitely agree with that.
Yeah.
For sure.
And general dentists that, I mean, I used to do root canals. I loved doing them. I would not do first molars. I would refer those out. They're very difficult. I just, the ones I knew I couldn't do properly, I would send out.
I did the
But
same exact thing.
yeah, and there were none that I thought caused any systemic harm because I was watching for that. I literally, and I recommend this to patients, tap on those teeth every 6 months. If they're tender, there's something wrong.
Yeah.
It shouldn't, and then get a cone beam every 5 years and not a regular x-ray. Regular x-ray will not show the true story. And if there's bone loss or laminodura, changes and all that, I mean, you've got to deal with it. And retreating a root canal is even less successful.
Exactly. Yeah. That's the one thing I was going to say that you hadn't mentioned is that just, yes, there's a lot of failed root canals. I think 3D CT or CBCT scanning should really be the standard of care, checking them, and also certainly before having one done.
Right.
And like you said, the way they're done is extremely important. And I would only ever, and I've done, I don't know how many root canals I've done in the past, but it's not necessarily, I enjoyed it as well. I actually, thinking back at the end of dental school, I thought about going into endodontics.
Endo, right?
And just because I thought it's so interesting.
It is.
Because the inside, like you were saying, the anatomy of teeth are so complex.
Yep.
But we just don't, even though we've come a very long way, we don't have the instruments to properly sterilize the inside of a tooth.
Right.
And whether it's getting reinfected from bacteria hanging out in the dentinal tubules, which you cannot clean, because even like lasers and what's called the gentle wave technique are the standard for root canals. And I've told patients this, and this is what I do, is we have a real conversation, and it's a lot better. I mean, it's the closest thing that we've got, that's for sure.
Totally. I would agree with that.
It just, I'm not.
How many dentists are using gentle wave?
There's one. We have one specialist down here. Certainly not general dentists.
Exactly.
And what I tell people is, if they don't have a microscope, they're not using a CT scan, and they don't use gentle wave, you don't even have to consider it.
Right.
So
I always tell patients, stay away from the dentist that does the root canal, and then a few years later or months later, it starts getting tender. There's a foreign body response, of course. They give you clindamycin, which is terrible for your gut. And then they keep giving an antibiotic, and it's like, no, that's the wrong way. It's failing. You may have to cut to the chase and take it out. It was done improperly. Antibiotics are not the cure for that, although it may give you a few years' time. I mean, but that's just kicking the can down the street.
Yeah, and it's just going to be more complicated because, I mean, at that point, in my view, you're going to have to take, you're going to have to take out the tooth. There's going to be less bone. If you even wanted an implant, it's just, it takes more time. There's more complications. There's a lower success rate. You had mentioned redoing root canals. I don't recommend redoing root canals. I mean, even when I was in dental school, they said that a significant drop in success rate. So it's like, why do it?
But isn't it terrible to fearmonger the patients saying that don't get a root canal? I mean, I get IG questions all the time. What's the alternative to root canal? Remove the tooth. No, I mean saving the tooth. There is no alternative. Just get it done properly. But to be told that, and they believe this, like, I can't have a root canal, I'm going to die if I have a root canal. And then they are forced to take the tooth out. Then they're facing the zirconia or titanium implant or a space maintainer of some sort. I mean, that's really unfair to patients, and I think that's very. And there are dentists online that say any root canal is bad for you.
Yeah, I hear
That's
that.
a strong statement.
It really is. It's a really tricky subject, which is why I really wanted to talk about it with you and hear your views on it, because in my experience, I have seen firsthand that people have said they remove the root canal teeth and their Hashimoto's is in remission. I mean, for example, and who am I to say that they're wrong?
Right.
I can't tell them that they're wrong. So, but what I can tell people is how that is going to affect you versus me versus somebody else. You do not know. And if you have other areas of inflammation throughout your body, if your diet's not on point, it can add an extra stressor to the body, long term, that you're not necessarily going to feel. And even if you do feel it, people ignore it because it's so subtle and it goes away, and they're like, "Oh, I must have just bitten down on something wrong." And they don't think about it.
Right.
So it can have complications, but not, and this is why functional dentistry and holistic medicine in general is so important, because it's not a one size fits all. And it really has to be personalized to the individual, and people need to be given realistic outcomes. And if somebody wants to have a root canal now, but just know that like you have to constantly stay on top of this.
Yes.
And you may very well need to take this tooth out in the future, and that's an extra expense as well.
Yep.
So it's just about having a really honest, in my view, an honest conversation with the patient, and letting them make their own decision.
Right. Yeah. The best dental treatment is no dental treatment in almost every case.
Yeah.
I mean, and that's okay. I mean, it's the same thing for medicine. But sometimes it's needed. And, you know, most of us didn't live past age 40 or 45 back, 100 years ago and centuries ago. And now we do, but it's not going to be perfect. You're not going to be in perfect health right up until the day you die. That is a challenge. There are very few people that don't have dental work, or bone loss, or receding gums after a certain age. And I'm not sure why that is. Do we outlive our dentition? Some people say that we're not living to our full age potential, 150 years. I've heard, if you listen to Dave Asprey, it's 180, right?
Yeah.
I mean, it's anyway. Yeah, root canals, that's a tough subject. And I just feel bad for a lot of people that are very fearful and scared, and they don't want to lose their teeth. And there's a lot of shame associated with losing teeth. And to be told that a root canal doesn't work, I don't think that's fair. But there's a lot of truth behind it. But it's kind of like an old wives' tale, right? And this is all based on a book that was written in the 50s by a dentist. I think it was the 40s. And there was very little data supporting that, but it has kind of stuck. And there are so many other things to worry about other than whether you're going to need a root canal or not. So
that's the other thing. I tell like, if you're going to start worrying about your health, don't start there. If there's an infection that we can see, obviously, and that's, but you have to start with the foundational things first, like sleep and nutrition and stuff like that. But and I've done quite a bit of surgery, and I will tell you, you can see these things on CT scans, and when you remove the teeth, and I've removed a good amount of root canal teeth, and all of them have infections. So it's definitely something that it's just that you have to have an honest conversation with the patient and the practitioner, and it definitely needs to be monitored on a regular basis.
Right.
So, awesome. So thank you for that.
Absolutely.
And you kind of brought me into the next point, which is implants, ceramic versus titanium. We don't have to spend too much time there, but what's your take? What have you seen recently or heard recently?
Well, so I wasn't placing a lot of implants in my day, but I was next door to a surgeon that we worked very closely together. We did a lot of difficult cases. So I restored a lot of implants, probably 10,000. I mean, because he was so proficient, and the price was reasonable, and he was very good at, and he did mostly titanium. And I would say 40 to 50% of the implants that were placed would have some exudate coming out of the sulcus. Every time I see an implant, I would just palpate the free margin of the gum just to see what would come up out of that. So there is a foreign body response. I think there's new data. I mean, back in the day, I was in dental school when who's the guy that invented the dental implant? Dr. Stenmark? Dr.
Oh, that's a good question.
I
should probably know that name, but
well, it's not important. It was in Sweden, and it was the artificial tooth. And we didn't have to do root canals or even crowns. We would just go right. And of course, now it's all equalized. And we know that not all people integrate. I mean, not all people are happy having that implant in there. There is a sensitivity to titanium dioxide, or the oxides of the coatings and titanium. And so is zirconia the next big healthy alternative? It's ceramic. Looks like it may be, but there are drawbacks to zirconia. Aesthetically, I would always recommend a zirconia implant on an anterior tooth, because a lot of that titanium would show through the gums. But it's better to keep your own tooth.
Yeah.
Is the answer, and I know that's not kind because a lot of people just don't have that option.
Yeah.
So if I needed an implant today, I would do a zirconia implant. I would see a specialist. That's all they do. Again, like a root canal, it has to be monitored, has to be cleaned properly. I would pick up a water pick, and I would become very proficient with that and focus on that. I would modify my diet. I mean, my diet is fine now for oral disease, but if I were someone that was snacking on stuff, I would be very careful because an implant is not perfect. People do respond to it. There are allergies and sensitivities to these things, and also if it's not placed properly. I don't know if you remember this. Maybe you're too young, but in the old days, if you perfed into the sinus, that was a big deal. Now it's not a big deal.
Yeah.
I mean, it's of course, if you hit the inferior alveolar nerve, that's a big deal. But so things have changed, and it's an artificial tooth, but is an artificial heart better or an artificial organ better than the real thing? No, we're still a long way from that. Maybe if we can harvest organs, and overcome the rejection issues, maybe we'll be there. But we've been talking about it for a long time. So implants, I don't want to be negative on implants. If you're edentulous, I did a lot of clip-on systems. People that were fully edentulous, the implants would get placed. I would wait 6 months with an immediate denture. I wouldn't go right away to loading the implants. These were full, sized implants. And I love, creating that denture that would work well for the patient, teaching them how to clip it in and then even opening up their vertical. And that was so satisfying, and it improved their life. So I'm not against implants. Implants are wonderful. And especially if you're missing a lot of teeth, it's a good way to go. Zirconia, unless, you're loading a denture or, there's a bruxer or, it's a very big, strong guy and has a history of a lot of load, then you have to be careful. But I would go with zirconia if you possibly can. And again, it's not perfect, but I think it's probably better than titanium. I do worry about metals in the mouth, even though titanium is low on the scale. Even silver is low on the scale. Mercury is not a metal, but that's in silver fillings. But nano silver, I think that could be an issue because of its size. So we have that in dentistry. What are the other metals we use? Zirconia. I don't know how you feel about this, but a lot of dentists are grinding those crowns to make the occlusion fit. They're not wearing masks. The patient's not wearing a mask. Your dentists that are around are grinding their zirconia crowns a lot have a increased incidence of lung cancer.
Yeah.
I mean, I still think gold is an amazing material. I was a Tucker trained dentist, and the gold inlays are absolutely amazing.
They really
last forever. Literally.
Yes, they really do.
Yeah,
they really do.
Yeah,
thank you for that. I do think that implants are very, very useful. I've heard a lot of mixed opinions, which is why I wanted to ask you. I mean, I know some surgeons that use zirconia implants. I know people that will not use them because they just break too easily.
They're brittle. So although they're improving.
Yeah. And so I'm waiting. I mean, I've started placing implants, but I'm really hoping and patiently waiting for when zirconia is just more optimized for implants.
Yeah. Again, it's like any artificial piece in your body. A lot of women with breast implants do just fine. You don't hear about those stories, but they eat a clean diet. They're very healthy. They exercise. They don't have any immune response. They don't have any gut issues.
Yeah.
If you have gut issues, you have an immune suppression issue going on, you don't want these artificial parts in your body because the body will respond to that. That's rheumatoid arthritis, for example. It's really, as you said earlier, it's about each patient. Some patients can tolerate a lot because they're extremely healthy.
Yeah.
Some, the minute they eat something, they flare up. And they've got gut issues, and I mean those are two extremes. But you really have to, before you put implants in, I think you have to know more about your patient.
Yeah,
are they going to keep the area clean? Do they have the ability and the dexterity?
Yeah,
or the want to do it?
It makes a really big difference. And I've had examples of just that full spectrum that you just described. I mean, a younger woman that she's allergic to almost everything, and then a 70-something-year-old woman that has, not that we placed, but I think she had like 12
Right.
titanium implants,
Right.
and
She's
she's
perfectly healthy.
all there too. Like
Yep. Yep.
joking, like she's
Right.
walking around on her own.
Bright-eyed,
Yeah,
strong. Yeah. Good
yeah.
balance. Everything. Yeah. Good
And
oral
then
health.
yeah, and that's
Yep.
why I think biocompatibility testing is really, really useful
Yep.
for people.
Yeah. I personally, I don't think we should be placing implants or doing root canals unless we know the state of the oral microbiome and the gut microbiome. That's full dentistry. That's functional dentistry. Are we doing that? No.
Definitely not.
No.
Definitely not. And last of these topics is a big question that I get that I find that not many people are using this appropriately, and that's ozone.
Okay, so I'm not an ozone expert. I'm sure you had a great discussion with Dr. Stacy. She is very good with this. It's a great adjunct to especially pediatric dentistry.
Yeah.
I mean, I practiced next to an ozone specialist. I don't think he was using it correctly. This was 20, 30 years ago. He was drinking it. He would put it in his drinking water and he was also recommending some other outlandish things. But I would say that there is a huge future for ozone in dentistry if applied correctly. If we could get it into a stable form in toothpaste, for example, or even a mouthwash, that would be great. I wouldn't recommend it for life. It would be during an oral microbiome reset or an infection or maybe post-surgery. It's great at reversing decay if it's properly applied with the gel. So, I mean, I used ozone in a different way. I bought a hospital grade ozonator. It was an expensive unit, but it lasted for a good 20 years. I would ozonate my office every night between 2 and 4 a.m. And there were stickers on the door, saying don't enter, in case staff forgot or something and came in. Funny story, we had those stickers up and someone broke into the office and I got a call at 3 a.m. from the sheriff. And so I went down there and he said, has anything been stolen? And I realized that they broke the window and then saw the warning stickers for ozone and left and nothing was touched. Anyway, but we would ozonate because back then we were, disinfecting the office, and ozone is wonderful at disinfecting. I mean, past what you can touch with a bactericidal wipe or whatever. And so obviously I couldn't do it during the day, and then the air conditioning was on and it would recirculate and would even clean the ducts and everything. So our office smelled great. It was clean. Hospitals use that in an operatory room. So ozone has it's very transitory. It's an irritant to the lungs, but it's not really that toxic. It's like CO2. I mean, obviously if it displaces oxygen, you're in trouble, or nitrous for that matter. But so I think ozone is underutilized in medicine, but also in dentistry. And I think if your dentist is using ozone, that's a really good sign that they are thinking out of the box. They've cast that net wide. They've seen the research. The research is amazing on ozone in terms of what it can do, even to blood. And other soft tissue applications and infections. And it's it's not a kind of a broad effect. It's very targeted, and so it's not toxic and delivered properly. So big fan of ozone. I just didn't use a lot of it because it really wasn't, it was still kind of woo-woo back then. And, but then again, I was using ozone for a good 25 years with my ozonator, and that really worked well. So
yeah, no, that's great. Thank you. We
you use ozone, right?
Oh yeah, we use it. We use it for countertops. We make ozone water fresh every morning. We put that in the hygiene units. We run that through our pipes because one thing that people don't realize is all the hoses and the pipes and stuff in dental offices.
Biofilm.
Awful, like the worst type of biofilm you can think of. And all that water is going right into people's mouths. And like you said, when you get it cleaning, there's bacteremia. And all that's just falling right in there. So it makes a massive difference. Yeah,
a lot of serious infections after a gum surgery or wisdom tooth extraction are caused by a biofilm kind of infection. And so that's been mandated now. I don't know what it's like in Florida, but in California, it was mandated that we had to filter the lines. From day one of my career, I bought a German chair made by Siemens, and it had a little pump in the base of the chair, and you had to fill it up about every 3 or 4 days with hydrogen peroxide, and it would circulate, including excavation.
Air, water, yeah.
Air water syringes. It would circulate hydrogen peroxide through the lines to prevent biofilm, and that was before it was mandated. So that is a big issue. That's something I have neglected to really write formally about on Ask the Dentist. And you brought it up. Thank you. And I should do that because that is a worry. And I think every patient has the right to, I would tell them what to look for. Now you can put in those little iodine filters at the base of your chair. Some chairs have it built in. A lot of dentists have invested in their chairs. So it's a retrofit kind of system. And so I think, if you were to ask the hygienist, like, when was the last time you changed that? How long is that filter good for? You have every right to know if the lines in your dental chair are not harboring some deadly, I'm using that word accurately, deadly bacteria. I had a friend and a mentor, orthodontist that was in California, and he was drinking his cuspidor water, and he probably died of Legionnaires or some kind of infection from biofilm. And that was before that was really well known. So yeah, biofilms come in all different ways and varieties, and some are good, some are bad.
Yeah, and
Like
just
anything.
for people to understand, if that is something that you ask at whether it's a dentist or their hygienist, and it's like a lot of them will say, "Don't worry, we use distilled water." That doesn't matter.
Doesn't matter. You're right.
Does not matter.
That is correct.
It needs to be cleaned, and even the chemicals, because I don't believe that it's mandated here, but it's just, it's stupid not to. You're going to cause a clog in your whole system eventually, and that's a huge overhaul. But the ozone actually cleans out these hoses better than those products that you can buy that are toxic chemicals. Totally.
Yes, exactly. That's a great point. Ozone is great at disinfecting without harming everyone around it.
Yeah, it's such a beautiful thing.
That are exposed to it. Yeah, it is.
Absolutely.
And it's readily available, right?
Extremely available. Yeah. And now, honestly, my patients are like, I have an ozonator at home. I'm like, you do? Like, I didn't even realize that like people are buying them for home now.
Right. Yeah.
Be careful how you use them, but make sure you learn how to properly use these things.
Exactly.
But
they can be abused. Yep.
Yes, they definitely can.
Yeah. It'd be great to make an oral irrigator, water pick essentially, that has ozone capability.
Yeah, that would be great.
People with implants. Yep.
Yeah, I think that would work wonderfully around implants. So moving on, thank you for indulging those big topics for me. I appreciate that.
Absolutely.
And the term you've been throwing around and I've been throwing around, we've been talking about is the oral microbiome.
Yep.
And we actually haven't said what exactly that is. And so could you tell people what that is, and then the difference between a symbiotic state and a dysbiotic state?
Great question. I think most people are aware of the gut microbiome. The gut microbiome was discussed and discovered before the oral microbiome. And then there are other biomes. There's a vaginal biome, there's an armpit biome, there's a brain biome.
The lungs.
Lungs, exactly. It's pretty evident that we are not in this alone, and that we need help, and that we're more complex than we originally thought, and we're not a singular organism. We're at least two different organisms, and we have this ecosystem, or this system. We're the ecosystem on board, and the question is who's in charge? Are we the vessel, or are they the vessel? And who's evolving? Who's it all about? And there are fascinating discussions on that. There's some physicians that think it's all about the biome that's in charge and that they're running the show, although they're having a tough time now because of the environment that the vessel we created. So a bunch of bacteria, viruses, fungi that live in our mouth. I think it's up to 800 species now. It used to be 700 just months ago. And similar to the gut microbiome, and they do things for us. It's part of our immune system. They help protect us in the mouth. There are some differences between the gut, of course, and the mouth. In the mouth, the oral microbiome is in charge of remineralizing our teeth. of establishing and keeping the biofilm healthy, of preventing tartar formation. There are proteins in our saliva, which is part of the biome, and the saliva has many functions as well. It helps keep the pH in the mouth so that pretty neutral, so that the oral microbiome can do its job. Again, we have that narrow window. But the problem is that the mouth can open. It's the opening to the digestive tract, to breathing, to the whole lung system, respiratory system, and also to the digestive tract. And it really is kind of a difficult position. I call it the pole position. It's a racing term, right? You know, when you're the leader and you have that pole position, everyone's chasing you. You're the one who's most likely to get into an accident. I mean, it's a difficult place to be, and you're very exposed. And the fluctuations in pH are great because the mouth can open and close. The gut is a closed system, pretty much. I mean, it's further downstream. It's in the dark. It doesn't have air come rushing in. It doesn't have cold or hot air or humid air.
Yeah.
Oxygen or other contaminants, air pollution, artificial objects, microplastics that are getting lodged in our mouth. The oral mucosa does allow it does allow absorption of that's how homeopathic medicines are absorbed quicker than if you take them by mouth and into the stomach. So there's some absorption there. It's a very unusual area. It's connected to the nose. If you mouth breathe all night long, you're going to end up in one night with some form of dysbiosis. These bacteria work very well. They can cause disease. You've got bad bacteria in the mouth right now. You've got all the bad boys are there. You've got the H. pylori that causes ulcers. That's very exists in the mouth. There are other examples, of course. And if everything is commensal or symbiotic, then all the players are working well together in unison. And it's kind of like a small town. Like, if everyone's getting along, there's no crime, people are safe. But the minute there is an adjustment in the system where, let's say, this is probably a bad analogy, but let's say education isn't as good, and then all of a sudden there's a disparity, socioeconomic disparity, and then some of the kids are being raised poorly, and then they break out and start causing crime. And I mean, it's almost like this concept of it takes a village. You really have to make sure that's all working well. Now, the minute we start feeding the mouth with, and again, what we eat doesn't go right into the stomach. It gets digested in the mouth. The saliva is a solvent. It basically is testing the environment. It's dissolving things. It's measuring what's in the environment, what's in our food. The taste buds are added as well. They're digestive enzymes, very selective ones being excreted by different saliva glands for specific purposes, whether it's starch or protein. But anyway, so the mouth is sampling the environment. It's breaking it down. It's digesting it. But that food, let's say, again, I'm picking on goldfish. Let's say you eat goldfish. That's going to harm the biome, just as it harms the gut, just as it causes spikes in blood sugar and glucose levels, right? And causes metabolic issues. So it starts in the mouth, and the mouth is not immune from a high glycemic food. It doesn't go down the hatch and pass it. And then those bugs, like the S. mutan bug, which is the bug, there are several others, but that is the villain for decay. It's there, but if it grows in population, and then the other bugs that modulate that are being affected by this, then you're more likely to get decay. So it's really about interpersonal relationships of all these bugs in the mouth. And it's so easy to unseat that and make it dysbiotic in the mouth. I would argue that it's easier and more immediate in the mouth than it is anywhere else of any other biome, the skin biome, brain biome, because those are a little bit more protected, and maybe the effect is delayed somewhat. So and then of course that biome, the oral microbiome, seeds the gut microbiome. There's some talk now about how the gut microbiome is linked to the oral microbiome in a reverse direction. There certainly is a gut-brain axis. There is now an oral microbiome gut-brain axis. It's all to back up a little bit. It astounds me that as healthcare practitioners, we think of the body as different systems. Like, I'm going to be an endodontist. I'm going to work on this. And we have our little blinders on, and we just work on that without any regard to what that part of the body plays, and it's all interconnected. And the fact that we've separated oral care from medical care is like ridiculous. It's like malpractice. Like, from a root cause, we are doing such a great disservice to our patients, because the physicians don't know what's going on with the mouth, and the dentists don't know what's going on with the body. But the mouth is such a great contributor to overall health and overall health issues. So the biome, the oral microbiome, is a key player. It's the second most diverse in the body. I don't know if that's true or not. It could easily be the most diverse. Talking about size of biomes, I think is irrelevant. It's about importance and the connections that it makes. And I think the oral microbiome is one of the key players in overall health. And it's because of the oral microbiome and its connections throughout the body. So again, we've been disinfecting it and carpet bombing it and taking it down and trying to nuke it, like get rid of it. And it always grows back within 10, 20 minutes. And we're actually making it worse. So the foods, the oral care products, our environment, mouth breathing, all of that is creating a dysbiotic oral microbiome, which has global systemic implications, and we're clueless. We keep recommending the same products and methods, and it's like, but it's changing. Yeah. It is finally changing. So the oral microbiome was a big part of, dysbiosis of the oral microbiome. There are now links to psychiatric disorders.
That's where I'm going next. So
okay. It's like, yeah. It's like, really? Yeah, of course. This all makes sense. And of course, there's brain health, Alzheimer's. The P. gingivalis bug is now a causative agent or factor mechanism in Alzheimer's. My mother had gum disease. She had Alzheimer's. She had sleep apnea. Again, it's not just one bad boy or bad bug. It's the whole connection of all these complex systems that are working together. And it's not just all human DNA. It's this other microbiome world and how it all interacts. And I don't think we really understand the degree of the beauty of the complexity of all of this yet. I think we're just kind of at the verge of understanding it. And if a psychiatric, or let's say a psychiatrist is prescribing medication for a psychiatric disorder, and he doesn't have oral microbiome results sitting on his desk. This is happening all the time. This is happening 99% of the time, and it's really not the best way to treat and heal as practitioners. So we're still a long way from figuring it out and having good systems in place because of the complexity and the beauty of this system. And the fact that we're still here as a species, to me, implies that we are extremely complex and resilient because of biomes and evolution and other factors. But there's some that are saying that we won't be around much longer. We'll see. How much can we take? So sperm counts, right? Down to zero by the year 2050. That's what I'm reading.
We'll see. I think that might be the case for certain people, but as we keep spreading these messages and awareness, the more awareness we create, which is why it's important to have these conversations, that the better these things will get as time goes on. And like you had alluded to, the systemic outcome of all of these different dysbiotic issues with the oral microbiome, whether it's cancer, Alzheimer's, autoimmune issues. Things like that. It's all linked, and we are literally at the tip of the iceberg when it comes to biome research and understanding and things like that.
Yeah, I think there are aspects of oral health that will affect your personality, your destiny in terms of who you are and who you marry or who you hang out with or who your kids are, how successful you are, your mindfulness, and your ability to cope. Facial development, oral microbiome, dysbiosis, and how that affects other systems in the body. So it's a big deal. And I think in a nutshell, when you think of dentistry, it's like a few holes in the teeth, bleeding gums, we'll scrape it, cut it, remove it. That's it. No, we are the stewards of something pretty major. And I think it's about time that physicians realize how important oral health is. I think they kind of think, oh, we're dealing with the heart and the brain. And it's like, okay, those are big deals, right?
Yeah.
Diabetes. I mean, these are big life-changing diseases, but the mouth is up there.
Yeah.
It could be the big one, I think, in many ways. And so we need more IFM trained dentists like Dr. Stacy. We need to be casting that broad net. We need more research. We need more evidence-based dentistry, and we need to be working with physicians. Physicians need more background in how oral health contributes to what they're working on.
Absolutely.
I used to work with a lot of cardiologists that were trying to reduce the CRP of their patients. So they were doing ablations and heart treatments, and I kept, pointing out to the patient, and the patient would connect us, and that most of the time worked well. And it's like, I have full-on raging gum disease, and that could be the major contributor to that little thing that you're trying to reduce, that CRP. Let's work together and figure this out. Of course, there's a double, two-way link between heart disease and gum disease. So, but yeah, it's the complexity can be overwhelming if you're a practitioner. If you just delve into it one day, you're going to be like, I can't do this. I can't. We can. we can do it. It's just a little bit at a time.
And appreciating it. I think that's appreciating the complexity of it is what I found is the key to it.
Yeah, we are one of the most complex and successful systems in this universe.
Yeah,
maybe that's
that we know broad, of for sure.
Yeah, that we know of. Yeah, okay. I didn't want to sound too arrogant, but that we know of. Yeah, that's a good modifier.
Yeah, and the other thing that comes to mind is that what affects the oral microbiome. We're talking about physiological things that you can see, like the food that you eat, but there's also the stressors that you can't see, and that's psychological stress.
Right.
And that definitely affects the different microbiomes.
Yes, certainly oral and gut microbiomes are affected by how we deal with stress. Definitely. Breathing. Yes. Your CO2, O2 mix in your blood, blood pH, all of those things are based on shallow breathing, lack of awareness and mindfulness. I mean, it's just incredibly complex.
Yeah, absolutely. Yeah. And you've talked about breathing a little bit, but what your book's about, the 8-hour sleep paradox. So this is quality versus quantity. And that's a huge issue. And it's something that I talk to patients about weekly. So what is the deal with how we're sleeping? What role does it play in our health? I mean, what is the difference between the quality and the quantity, and how are they correlated with one another?
Well, short answer is read the book.
Yeah, for sure. Definitely read the book.
Yeah, and the book's already 5 years old. There have been some changes, but the book is really a how-to manual. When I discovered, and my wife discovered that we had sleep apnea, and we're both in healthcare, we were shocked at how complicated it was to get help. And that's what the book helps, how to identify it, and then how to get through the system and get the care that you need, so on the other end you can feel better. So I'm going to connect it to dentistry. So dentistry really is I think, the primary profession that deals with airway issues. Again, because we can see it in its prodromal phase. So you got a kid, can't breathe through their nose, adenoids, tonsils swollen, tongue tie, facial development is affected by age 9. This area that we call the mouth is narrow, not fully developed. The thing most people don't realize is that this space is connected to the nasal box or space and the airway space. Think 3 boxes, and the front box is that mouth, and that box is narrow, doesn't protrude as much as it should. It should be open, and because of that, all the other bony structures that are connected to it also don't develop correctly, and then you can't breathe well. You can't breathe well through the primary airspace, as it narrows before it gets into the lungs. And also the nasal passages are constricted or completely blocked to the point where you can only breathe through your mouth. And all of those things can be addressed early on by dentists and recognized, again, as I said earlier, decades before a physician can. Physicians typically see it if a patient comes in and says, listen, I failed my Epworth test. or if I read Dr. Burhenne's book, I failed it on purpose. I got a 12 out of, a score of 12. Anything over 10, they pay attention. And by the way, I fall asleep at the wheel as I'm picking up my kids from school. I mean, these are all tips in the book just to get attention from your primary care physician. Again, I was a very thin, healthy, very active person. And even though I had 12 interruptions per hour, they found that out after the fact, after I convinced them to get to prescribe a sleep study for me. Then they're like, oh, wow, okay. So sick people that have symptoms can have sleep apnea, right? What a concept. Anyway, dentistry should play a bigger role in this, and that's coming. There's an organization. I got all my sleep training from the American Academy of Dental Sleep Medicine.org, AADSM.org, which I still recommend to find a provider. If you think your child or you have any sleep disorders, I'm beginning to say now, go see a dentist first before you see a physician, because the pathway to healing and feeling better is much quicker and more efficient. And again, AADSM is an arm of the AASM, which is the medical side of things. So it does involve the medical side of things. And address it early. Don't assume, I say this in the book, don't assume breathing. How do I say it? I say that sleep is not. It's innate. We can all sleep, but it's not guaranteed.
Right.
It's not guaranteed.
That is what you said.
And then I follow that up chapters later. You need to verify your ability to sleep, and you needed to do it often. Now, back then we didn't have the Oura Ring. It's not perfect, but it's a great way to measure sleep. There's some countries that require sleep apnea tests at very early ages on pretty much everyone. I think it's Italy and Iceland. I think that's a great model because most chronic diseases are related to sleep apnea. What if you caught that early on? What are the savings to Medicare or the healthcare systems and the costs associated with modern healthcare? What would the savings be? There's some studies that say just by dealing with gum disease, there's a savings of, this is a Columbia College study from 2005, 150 people in the study. They were all insured. They all had dental insurance. So these were very healthy people. When when gum disease was addressed and under control, they calculated a savings of $265 billion per year in overall healthcare costs. That's just an example of how if you can fix the mouth and keep that under control, that it has these global ramifications, right? So I think sleep kind of falls under that as well. We wait till it's a problem. Again, I should have known I had sleep apnea. Again, my mother had it. I should have dealt with it earlier on. And instead I waited till someone was beating me over the head with a pillow, right? And even that was an early warning, right? I could have had a fib when I was 55, right? And that's a comorbidity of sleep apnea. So anyway, in general, I would say dentistry is in a wonderful position to be on the front line with dealing with this significant healthcare issue. And I think it should be very encouraging to all dentists, because we are really, again, in that pole position. Should be considered to be an important part of the medical system. We're not just drill and fill. Yeah. We should be, and this is happening now. There was a fight going on for a while. It's still going on, where physicians were worried that dentists would, be able to diagnose sleep apnea. We're still not allowed to, but we can screen for it. But you're seeing changes in that, where dentists will just come out and say it, and then they'll run with the treatment. They'll do a cone beam. They'll look at the airway. They understand facial development. Physicians don't. And this is on young children. So if you can get that airway open, get that facial development correct, or to its full potential, you've just saved that patient's life and you've changed their destiny. Yeah, I'm not trying to sound like a Star Wars fan here, but I mean, it's big. It has huge implications for the welfare of that person and their life and their wellness in general. So it needs to be, every dentist needs to be up to speed. And in fact, the ADA has said this, that all dentists need to come up to speed and learn how to screen for sleep apnea. Not necessarily treat, but screen for it. And I think that's reasonable. I think it should go beyond that, but it's a great start. And are most dentists doing that? No.
Not in my experience.
No, but easy solution here, actionable item for anyone that's listening. Go to aadsm.org, go to their directory. You'll find a list of credentialed, very well-trained dentists, and they will get you up to speed, whether it's your child or yourself, on sleep apnea or any sleep disorder breathing. And they have a referral network to physicians, to the properly trained and enlightened ENTs, pediatric ENTs. Most of the time when you go see a your primary care physician, you will get turned away for sleep apnea.
Yeah.
That's just the way it works.
Yeah.
You got to get past that threshold of that test is very expensive. Insurance companies, there are physicians, especially in a system like Kaiser and those kind of healthcare models, are incentivized not to RX sleep apnea tests and other expensive things like MRIs and all that. They are incentivized to do that, to prevent that from passing through. I won't go into all the details, but it's amazing. It would be shocking to anyone listening. Yeah.
Yes, a lot of these things are very unfortunate, and so you actually answered part of my next question, because you were talking about the physiological manifestations. Some of the things people can kind of get, at least have an idea, like that doesn't look right. But what can someone do for their child, essentially, to prevent these types of things? And then obviously you listed where people can go to try and get these things corrected or improve and get more information about once you already have an issue. But how can they actually prevent? What are some actionable things people can do for their kids?
Right. I think I'm trying to come up with a simple, actionable reply. I think have a dentist. Make sure that the family dentist is airway centric, because when your children come in, they will pick it up very quickly. If you don't have an airway centric dentist, you may have to you will find out about your child's sleep issues, airway issues, sleep disorder, breathing issues, if you're lucky, by age 20. You'll have a tough time during their teen years. Maybe there's ADHD involved. That's all related to small airways. Allergies, not being able to breathe through your nose is related to increase in allergic symptoms and hay fever and all of that. And other issues as well, cognitive ability, grades in school, their ability to interact with other kids. So wouldn't you want to find that out in year one rather than waiting until they're an adult? Or you may not even find out until that adult is 40 or 50 years old. So again, my reply to that, my straight, just simple reply to that would be, make sure your dentist is airway centric, that they're trained, and get that out of the way early on. Could be a tongue tie. Tongue ties, there's so many undiagnosed tongue ties out there. And if the tongue is tethered and can't move around properly, that it's the shape of that box, that mouth box I was talking about. A lot of it is from the motion of the tongue, the ability of the tongue to move around and at rest even. But if it's tied down with that kind of vestigial tissue that doesn't burn away or necrose away when it should, that's going to give you a very narrow face. So I don't know if that answered the question. I mean, there are a lot of things you can look for as an adult. I have lists in the book, like scalloped tongue, dry mouth, going to the bathroom in the middle of the night a lot. I mean, that could be related to sleep apnea, not getting older, restlessness, napping. I don't think napping is normal. Snoring, we talk about snoring. Snoring is absolutely not normal. It's not cute. It's not funny. Snoring is the sign of a serious disease process in process, and should be addressed right away. And your children can snore. So if you're a parent, for example, in that case, I always recommend that the parent, usually the child goes to bed at 8 or 9, parent goes to bed later. Before that parent goes to bed, I would go into the room, don't turn on any lights, just lean up against the bed. You're not facing your child necessarily. You can have like a little Kindle, or I wouldn't bring in your phone, or just sit there and meditate for a little bit, do some breathing exercises and listen. What position is your kid in? Are they up on their knees? Are they sleeping on their stomach? Have the covers been thrown? Have they spun around 180 degrees? Are they really hot and sweaty? What's their breathing sound like? If you can hear anything, that's not normal. It should be silent. What's their respiratory rate? That's easy to measure. I mean, you can just count it out. All of those things. You as a parent, you can catch these things early, especially if you go online or read books, and so catch this early. We have the means to fix it and address it and recognize it early. So there are several other things.
Are there certain things that parents shouldn't use for their kids? Like, I think that sippy cups is one of the things that I've heard of that can cause an issue.
Yeah, I'm not a big fan of pacifiers. Certainly, sippy cups, if they have a lid and that little spout, that is probably can affect their development, their facial development. There are certainly a lot of alternatives. There's a company out there called Easy Peasy, EZPZ, that makes wonderful silicone devices. Where, I mean, my second grandchild son, Jack, he can pick up a tumbler and drink from it because it was made by Easy Peasy. It has it's bottom weighted. When you put it down off center,
so it doesn't spill and stuff.
Doesn't spill. It's soft. It's small. I mean, think of it. We're giving our kids utensils and cups that are sized for different sized hands and even lip shapes and this woman who owns the company has designed the lip in such a way that it's designed for a smaller mouth opening so that the liquid gets transferred properly. And then that affects the swallow reflex. Drinking from a straw has a different swallow reflex. The swallow reflex really, which happens all day long, can help develop the muscles of mastication and swallowing and speech and all that is what determines the shape of this little cage right here, the jawbone. And so tongue position, even at rest, is important. Where does the tongue hang out? That's pushing out and creating that width in the maxilla. Unfortunately, our ideal of beauty has changed. I mean, if you look at all the movie stars, they have very angelic faces, very chiseled triangular faces, very small lower faces. That's not a sign of beauty. It's certainly the form has overtaken function in that case. So I don't know if that answers the question, but there are a lot of things that you can do as a parent and a lot of things you shouldn't be doing. Breastfeeding is important. Breastfeeding is very important. And I don't want to shame any moms that can't. And if that's the case, then get help on that and look for certain things. Again, see your dentist. Bring your child in when they're a month old, if you can. Bring them in with your visit. And then that way they can take a little quick peek. And I don't know how early you recommend they come in, but I think sometimes earlier is better because they're less fussy. You can get a good look. You can check for a tongue tie. I recommend having a tongue tie present at birth because I can't tell you how many times a hospital has missed a posterior tongue tie. It's shocking.
Oh, yeah. If they even look.
Right. So then those first 3 or 4 days, breastfeeding is a mess. It's difficult, doesn't work. And then they go to the bottle. Well, it was probably because of that posterior tongue tie that was missed. And sometimes they're so excited, they catch the anterior tongue tie, they do a quick snip, and they're like, "Ooh, we're a cool hospital because we're checking for tongue ties." I can't tell you how many posterior tongue ties have been missed. Breastfeeding becomes a disaster. Postpartum depression is more likely in that case. Kid is suffering. Dad is suffering. The whole family is suffering. I think I don't know who would pay for that and how insurance would be willing to pay for that, but I think that's a great preventative. Have a tongue tie expert. It can't be the physician that's delivering the baby. It can't be a nurse. It has to be someone myofunctionally trained, and they should be present at birth. So if you can afford it and you know of someone, find out, have them present at birth for all of your children. That's sounds extreme, but
no, I understand. And I mean, it's not necessarily going to be available for everybody, but it's definitely good to be aware of.
Right.
And you brought up the last thing I was going to say on this topic, which was myofunctional therapy. For either older kids and even adults. I mean, these are different things that we can do to help with these kind of problems.
Right. Yeah. Myofunctional therapy is something that most dentists, and I include myself, we're just not well trained in it.
Or at all.
Yeah, exactly. Right. That's more correct. And so I always say that a dentist that doesn't have access to or in-house or doesn't refer to a myofunctional therapist, is practicing below the standard of care. It's that important. And there's so many things you can do. So, for example, I talked about position of the tongue. I don't think most dentists know whether the teeth should be touching or where the tongue should be at rest and what that looks like. But a myofunctional therapist does. And if it isn't proper, they know how to get it there, and they can teach a child. In the old days, it was called a speech pathologist.
Yeah.
You remember that?
Yeah.
Maybe not. And I used to refer to speech pathologists, but it was always based on speech. And that's really shouldn't be the guiding principle. It's tongue position. Is it mouth breathing? Is it a tongue tie? The inability to breastfeed or difficulty breastfeeding. So these are all things that can be addressed, even in adults. A lot of adults, I mean, there's so many undiagnosed tongue ties out there. They have accommodated to that inability to move the tongue around. And so when it does get snipped, they really should have the myofunctional therapy before. Many reasons for that, but so that when the tongue is able to do what it's supposed to do, they know what to do with it. It's a learned response. There's muscle memory involved. And just getting a tongue tie fixed is not enough. So definitely myofunctional therapy, huge importance there. Don't underestimate the power of good myofunctional therapy.
Yeah, no, thank you for that. And we're going to start winding down here. I mean, there's other topics like oral probiotics, glycerin, xylitol, all these different things that I'm going to direct people back to your podcast at Ask the Dentist, because you covered these things, and you're really, one of the things I appreciate, you're really good at staying on top of these things too. So thank you for that. And to close out this part, really, I have conversations with people and patients about this all the time. So what should people be looking for in a dentist? How can someone actually know that someone is practicing as a functional dentist or a biological dentist?
Right. That's a great question. It's a very important question. Few things come to mind. Call ahead, ask them whether they use a fluoride varnish. And if they do, how would you feel if I refuse the fluoride varnish? Is that an option? How often are x-rays taken? Are they taken at every visit? Are they taken before every procedure just to cover someone's ass? I mean, right? I mean, in terms of malpractice, I see this happen all the time. Are they cleaning the lines, the dental lines on the dental chair? I mean, ask these questions. You have every right to know. And so if there are a lot of pushbacks on things like that, then you have a problem. Most people have a gut feeling on this, and I would say the minute you feel that way, act on that, move along. And most good dentists will advertise now in the internet world, the age of the internet, they'll advertise that on their website. What is their philosophy? Are they working upstream? Are they functionally minded? Are they looking for root causes? If you keep coming in with cavities, are they giving you counseling? Are they giving you tips? Do they have online resources? A lot of dental sites are just, this is who I am. This is where I went to school. Make an appointment. Yeah. That may not be enough. We tried to make this easy. I mean, when my daughter and I started Ask the Dentist 11, 12 years ago, we kind of created a problem where we educated all these people to what to demand and ask for and what they should be getting. And then they kept saying, well, there's no one out there who's doing it. And so we created this directory, and it's a functional dentist directory. You're on it. Thank you. And it's that just kind of simplifies it. And that has worked out very well. I would say 99.9% of the time we've gotten rave reviews on, oh my God, thank goodness this made things so much easier, because these patients know better. They have a higher dental IQ. They know what to expect. They know what's toxic. They know what's bad for them. They know that mercury fillings are not good for their kids. They know that fluoride, there are issues there. They may not fully understand it. That's okay. But they're just trying to do their best. But most dentists they see will, they just won't really address, or they'll even get shamed for even bringing up that topic. And then, if you come in and see a dentist and he says, and you ask your dentist, you say, I Googled this and there was some controversy on that. A lot of dentists, a lot of physicians, they call that Dr. Google. They recoil. They're like, they classify that patient as a whack job. And they're like, they just don't want to hear about it. If that's what you're feeling, and there's no discussion or like at least acknowledgement of it, and if they're honest and they say, I don't know much about it, tell me more, or they can have a decent conversation with you on that. That's a good sign. But if they just discount you and define you as that kind of, we used to call them PITAs. I don't know if you use that term in your practice, pain in the ass patients, right?
No.
I mean, it's that is unfair. It is your body. You're there. You have a bill of rights as a patient, and you deserve a full explanation of why he's doing that. And if you don't feel like it's right, even though you may be ignorant or not as educated or not as knowledgeable as the provider, he has the fiduciary duty is on his or her side of the equation. They need to explain it to you. That is our number one role, is to educate and to inform, because it's not perfect. There is no perfect solution. Once you're sick, there are drawbacks to treatment, and patient needs to know what they are. And if they don't like it, and if you don't like it, you don't feel right, or if you're getting a bad vibe, move on.
Yeah, for sure.
Yep.
I totally agree. And I actually have patients that come in and they apologize for asking so many questions.
Mm-hmm.
And I say, no, please,
nice.
and it is nice, but I also encourage them to continue asking questions, because not only do they get their questions answered and they learn something, and if I don't know the answer, obviously I'll find out, but I learn from them too. I mean, some people come in and ask questions that I haven't been asked before. And I'm like, that's a really great question. Like, I haven't heard that perspective on things before.
Right.
So,
if you feel like you're being hurried along and they're trying to get the job done, what I would do is, if the questions carried us over and I couldn't complete the treatment in that allotted time, I would say, you know what? I enjoyed this conversation. I hope I was able to answer all your questions. You can email me at this address if you have any other questions, but we're going to have to reschedule you for another visit. I hope you don't mind. They never had an issue with that. That worked out just fine. So if you're a dentist who feels like they don't have enough time to give that information, I think it's a great practice builder. I used to bill for some of that. Long story on that, but in most cases we would bill for that, and most patients were okay with it. It depends on who your patients are and the socioeconomics and all that. I wasn't billing, I was billing insurance, but they would pay up front. So it was a different mentality. It was an indemnity practice. So that wouldn't work in a PPO practice. And but if you're a patient and you're at a PPO practice, you can't expect the dentist to give you that information. So it's not his fault. It's not the dentist's fault. That's just the way the system works. You're going to have to go find a functional dentist or a holistic or an integrative dentist, or someone that has that model where they're willing. And then that's a patient, that's a dentist that you'll want to keep for the rest of your life, because you're going to get better care. You're going to get better outcomes. You're going to save money.
Absolutely. And that's what people don't necessarily realize, that you will save money at the end of the day.
Yep.
So thank you for that. My last question for you, and I always like to close with this. And if this were the last time you ever had to share your thoughts, and you could only share 3 things that people should start implementing into their lives immediately to improve their health, what would they be?
Oh boy. Well, the obvious one is how important oral health is. Don't underestimate oral health. In many cases, it is the root cause for most things. I would say 6, maybe 7 out of 10 diseases have an oral component to it, oral health issue. And that's a biggie. And I don't think that message has gotten through to everyone yet. So I would definitely say that. If I only, what would the other things be? I think seek out the right provider. Your kind of healthcare journey is directly related and heavily influenced by the person who is, it's not in charge of your healthcare, it's who you're working with. And that has to be a really good relationship, a very effective one, in terms of results and communication. So if there's any problem there, shaming or dismissal, get a second opinion. You need to build a team of good providers for your whole family. And that's difficult to do. I'm not saying it's easy.
Yeah.
Sometimes you're lucky, you pick the right dentist or the right physician, and then they can, from that one point on, you get referred to really great people. And that is probably the greatest determinant in how you're going to age and what you're going to come across. And we talked about it. For example, if you're seeing a airway centric dentist and sleep disorder breathing runs in your family, I mean, let's face it, 60-70% of us have some version of that right now. So that's the majority of us. And that gets addressed early on rather than later in life. That's going to change everything.
Mm-hmm.
It could even have generational effects.
Yeah.
I mean, down the road. So that would be the second one. Third one, I don't think I have an answer for. What was the question again? Like, if I could only give this
Three
piece of
things.
advice last time, right?
This is the last time you could share your thoughts and
Right.
the three things that someone can implement in their life immediately to improve their health.
Right. Again, first thing that pops in the mind, don't trust big corporations. I'm talking about toothpaste companies, food companies, cereal companies. They're advertising, for example, Listerine. They were saying as effective as floss. I mean, stuff like that. I mean, just rinsing with, something that would take down the oral microbiome and elevate your blood pressure, right? And then they had to retract that. I mean, it's just, don't be careful the trust you put in. If they're pushing an ad on you and telling you things that seem a little too good to be true, and they're making a lot of profit from it, really sit down and think about it.
Yeah.
Really make sure, ask someone who doesn't have a financial, gain in the process, and make sure do research. I mean, read the studies, or interact with people that have read the studies, researchers, and get the information. Get raw data. Don't fall back on and believe the stuff that comes later from a company that's trying to capture your dollar.
Yeah.
Because it will literally kill you.
Yes. So in summary of that, so it's really prioritize oral health,
Mm-hmm.
find the right providers, and be careful where you get your information from.
Yep.
So
yeah, and go to bed at 10 o'clock, not 12 o'clock.
Yeah.
Seriously,
yeah.
It's amazing.
For me,
does.
sleep. Honestly, the two things I talk to every single person about is sleep and nutrition. It's 1A and 1B for me.
Yep.
So.
Yeah, it's easy. Go to bed within 2 to 3 hours after it gets dark.
Yeah.
If you wait too long, everything gets messed up. The
Mm-hmm.
rhythms, the circadian rhythms, your hormonal levels. Then you start getting hungry again, and let your body. It's tied to light.
Yes,
and
that's what I was going to
say. The planet, the Earth going around through the solar system, and we're linked to that. There's no getting around it.
Yeah.
We've got light bulbs that can keep us up later, but the damage from that is so profound.
Yeah, incredibly so. Awesome. Thank you so much, Mark. So a quick recap, everybody. So Dr. Mark Burhenne and Ask the Dentist on Instagram. It's at Ask the Dentist, and also askthedentist.com. We have a really, really helpful book called The 8-Hour Sleep Paradox. Okay. I would highly suggest people look into getting this. There's a lot of great information and tools. That's the thing that's really great about it. It's not just giving you information, it's actually giving you actionable tools. And I thank you for putting the time to that, because I know people that have written books and it's a lot of work. So
it is, but it's a lot of fun, actually.
Yeah, great. And are there any other resources, courses, projects, or anything that you have out or in the works?
Yeah, plenty. We've already released the Reset Your Oral Microbiome program, the one I mentioned earlier with Dr. Stacy. That's a 6-hour course. If you're a provider and you're new to the oral microbiome and to the new ways of thinking and functional dentistry, I would recommend it. It's not linked to any CE credits yet. We are going to offer a version of that, but if you want the information right away, I would highly recommend it. That's the root of all issues, is the oral microbiome. You need to understand that, whether you're a practitioner or a patient.
Yeah.
So I would definitely go there. We'll be offering that every quarter. I don't know when this episode will release, so the timing may be off a little bit, but don't worry, it'll be offered every quarter. You'll have access to both Dr. Stacy and I. We have some live sessions. We also have the directory at askthedentist.com. That has become just a resounding success. I'm very, not surprised, but very pleased that that's helping a lot of people. People really, I get Instagram messages all the time going, "Oh my God, this is great." It just feels right, and so that, and they're finding people like you, and so that's a big win and a great resource. And we've got other e-products. Just go to the website and peruse. You'll see product recommendations, and there are a lot of products out there that you shouldn't be using that are really bad for the oral microbiome. That's what we talk about in the course. We have a big PDF handout on products that work. And of course that continually changes as well. But most of the oral care products you're using today are not oral microbiome friendly.
They're the opposite, actually.
Yeah, exactly. Right, exactly.
So thank you for that, Mark. And everybody, as always, your comments, feedback, and suggestions are always welcome. Thank you for watching this episode of The Art of Mindful Medicine with myself and Dr. B. Please click all those like, subscribe, and share buttons below. Appreciate that very much. And you can see all of past and future episodes here, The Art of Mindful Medicine. And as always, I like to end with a quote. This is by Jane Goodall. And she said, "What you do makes a difference, and you have to decide what kind of difference you want to make." And that applies to both your health and the surrounding world, everybody. So
absolutely.
Thank you so much, Mark. Appreciate you, and everybody watching. Thank you again. And I hope you all have a beautiful day.
Thank you, Seth.